All right. Hey, everyone. Thank you for joining us back in the Health Writing for Health Professionals 101 series. As you can see, I have with me two wonderful guests today who are going to help contribute to this conversation. The first is Alyssa Billingsley. She's a pharmacist who is the director of pharmacy content at GoodRx. And we're also joined by Sophie Vernio, MD, who is the lead medical editor for GoodRx Health at GoodRx. Alyssa, Sophie, really nice to see you both. Thank you for being here today.
Thanks
For
for
having
having us.
us.
All right, so we're going to be diving into a conversation that is very relevant to both of your roles at GoodRx. Before we learn more about what you all look for in the writers that you work with as a part of your role, I would love to know from both of your perspectives, what is health content and why is health content so important to a company like GoodRx?
So I think that GoodRx is all about empowering people as they're navigating the healthcare system and making decisions about their health. So I really see health content as information that they can use and trust to help them make those decisions, whether it's about managing their health conditions, taking their medications, or finding ways to make them more affordable. So I think that's where GoodRx really has an interest in helping people navigate this process.
Yeah, I don't have very much to add other than, we've made it our business for 10 years and counting now to help people make better decisions about how they spend their money and where they spend their money. And that's really important when it comes to their prescription drugs, but that challenge doesn't end there. So helping people make better decisions about how and where they spend their money when it comes to every aspect of their health is just as important as prescription drugs. And that's what we're trying to do. Um,
Yeah.
and I think the other thing is that we've identified the fact that there is such a huge gap between health information that's available to people in the know, so clinicians and academics, and health information that is available to the public. And what we're trying to do is bridge that gap.
Mhm. I love that idea of bridging the gap. And Alyssa, you also mentioned, I feel like a key term during your answer, which was trust. How do you all go about helping build that ecosystem of trust within the health content that you all create and contribute to at GoodRx?
Sure. So I think from speaking from the pharmacy side of things, all of our pharmacy and medication content is written by pharmacists. So the people who know the medications best is writing, including their perspective. We work with a lot of retail pharmacists who field questions day in, day out from patients. And so we're trying to provide information that's relevant to them and relevant to their care. And everything is also medically reviewed for accuracy by either another pharmacist or a physician, depending on the topic.
And this two-step clinical review that Alyssa's talking about is something that's really unique to us. So a lot of our competitors, the way that they address their health content is they have it written by a health writer or a health journalist, and then it goes through a clinical review stage, further down the pipeline, so to speak. We took the approach, 3 years ago when we started really branching out into health information creation, that we were going to have the stories created and generated right from the outset by somebody who was experienced in having those conversations with patients, whether it is in the clinic room or in the pharmacy. And so from the point at which we decide on the title and we decide on the angle of the piece, that is being done in partnership and being written by somebody who is experienced firsthand
Mhm.
in addressing those issues. And we think that that just makes for a completely different quality of content for our readers. And then we have it reviewed again at the end by either another physician or a pharmacist if it's information that really branches or straddles that divide between health
Mhm.
and pharmacy, to make sure that we really, like, there are no inaccuracies that slip through the net.
Yeah, I think that's a really solid approach. And it makes a lot of sense because a lot of times the way that you might even frame a conversation or a particular topic, unless you have that core expertise in that area, you might not even think to frame that conversation or that topic that way. So I'm thinking back to my time writing for GoodRx and working with amazing people like Alyssa and Benita to say, hey, here's the outline that I'm thinking of for this piece. if I hadn't had the background in that particular topic, you know, whether it was a vaccine or a medication, I might not have thought of arranging the outline in that way. And like you said, that directly impacts the information that the person reading is getting and how they're getting it. So I love that you all have that approach.
Yeah, and there are nuances. You know, you can do all the research in the world, and there are certain nuances that you just will never pick up on from reading things or getting that
Mhm.
information secondhand, right? You have to have been in that situation to know what is the difference between what the literature says and what actually really happens on the
Yeah.
ground.
Yeah. And patients deserve that information, right? That's informed by that real life practice and
Mhm.
experience. Okay, so you've mentioned writers a few times, of course. You both work with a variety of writers. Can you explain, I guess, from a high level perspective, what does it mean to be an in house content writer, which is a term that someone might come across, versus a freelance content writer? And when would a company lean into in house support versus freelance writing support?
So I can speak from the angle of freelance writers because that's who I primarily work with, and I think Sophie can probably elaborate on in-house. So I primarily work with freelance writers, and so we recruit pharmacists of all different types of backgrounds depending on the content that we're looking to write. We do have several in-house pharmacy editors, like myself, so we mostly assign articles to the freelance writers, but we do also try to write several articles every month ourselves as well.
Yeah, and so on our team, we have a huge pool of freelance writers who we rely very heavily on, but we also have a couple of those freelance writers who we've transitioned to more of a part-time in-house role, and we've done that I mean, we did that about a year ago with some of them, just really out of necessity. Like we were scaling at a pace that was really difficult for us to match, especially at the time where we were hiring a lot as well. And so I ended up hiring some of my strongest freelance writers in-house in a part-time capacity, and that worked really well for them, and it worked really well for me. And anybody who's worked freelance or who has worked with freelancers in the past knows that there's that constant juggle between like, how do I, you know, I have this client and I have this client, and like I've set aside time this week, but they haven't got me that work back, and I've got all this time, and I don't know what to do. And then by the time you're free, then you know, like, or by the time you hear back from them, then three other things have landed back on your plate as well. And so it's this constant, you know, like feast and famine of work. And so what we found, or certainly what I found with the freelance writers who came in part time, it meant that they were able to confidently drop some of the other work that they maybe weren't so excited about, knowing that we were going to have, you know, I said to them, like, there is no shortage of work with us. We will always have work for you up to like X amount of hours per week. And so for them, it meant that they knew that they were going to get that time, you know, covered every week, that they would always have enough work to do. And for me, it was great because it meant that I had these more versatile, skilled writers available on hand to turn things around really quickly, to jump into, you know, a variety of different types of assignments. And then it's a self-fulfilling spiral, right? Because the more things that they jump into, the more they feel a part of the team, the more they know about the work that we do, and the more invested they are on the success of the team overall. So it's worked
When
well.
you talked about the feast and famine, like I think all freelancers know that that is very real. And so it's really exciting to have long-term partners that you work
Mhm.
with as clients who you have that mutual trust with each other. You know each other's writing styles, editing styles,
Yeah.
and it becomes much more of a smooth relationship over time when you can build up that strong foundation. So that's really exciting to hear that you were able to do that for some of your writers. Going back to writers and kind of you alluded to some of your strongest writers, right? Being a
Mm.
part of being brought into that part-time arrangement. When you
Yeah.
are evaluating potential writers, what specific skills, writing specific skills, do you look for in someone who you're bringing on the team?
Yeah, I mean, so I can jump in and then hand it over to Alyssa because we both do this week in and week out. We're assessing who we want to work with and who we want to work less with. Um, but I would say I mean, from a writing perspective, it's, you know, is the writer able to tell a really good story? And by that, I mean like plan out a compelling narrative for their piece and really convincingly and effectively take some very complex, sometimes ambiguous information and condense it, not simplify it, but really condense it into something that is easily digestible. And I say not simplify because sometimes it's important to simplify it, but what I think a lot of people do sometimes is oversimplify things, and then you go too far in the other direction, in which you're leaving the writer with sometimes more questions than they started with. And I think that is a bad outcome for a piece of writing. So it's really like that fine line between being able to condense something, being really sure of the knowledge to be able to do that, and then answer the questions that you set out to answer definitively. And that takes real skill, not only as a clinician, but also as a writer, to use like very focused language, but in a way that is really mindful of health literacy.
Yeah.
And
Before you go, Alyssa, can I ask a follow-up question, Sophie? So that is definitely a skill, like you mentioned. And as we know, a lot of healthcare professionals don't really have the experience in writing in that particular way. If they have writing experience at all, sometimes it is, writing a journal manuscript or putting together a set of slides or a poster presentation, things of that nature. And so this is oftentimes a skill that unfortunately healthcare providers, for the most part, don't get to develop. So when you are evaluating potential writers, are you looking for folks who have already demonstrated, like clearly demonstrated the ability to make that narrative and determine that narrative? Or do you kind of look for surrogate markers that might indicate the potential to get to that point?
And I think the answer is both. Like there are some people who come fully baked with all of the experience that makes them perfect for this role, and they're ready to jump in, with their 2 feet and really hit the ground running. But those are unicorns. There aren't very many of them around. And so I think some of the surrogate markers that I look for are humility, mostly. Like humility in the professional to recognize that they will probably have to, and I'm very clear about this, they will have to unlearn a lot of the jargon and a lot of the language and the style of speaking that they have been learning for sometimes decades, and start right back up from the ground up in building a vocabulary and a style of communication that is entirely new. So I look for humility and willingness to grow, and openness to recognizing what they don't know, and the excitement of learning this new skill.
Just to reiterate Sophie's point, being able to really boil down these complex clinical topics into terms that are more easily understood. And I would say that this is particularly difficult to do in pharmacy because you're dealing with drug mechanisms of action, which can get, very, very difficult and complex. And so I found that pharmacists that have sort of that experience in counseling patients and having to do that in the day-to-day, they tend to have a little bit easier of a time. I think sort of getting there more quickly, I would say. Also, being able to take a dry, somewhat boring topic and make it interesting. So whenever I'm looking for writers, to Sophie's point, it's sort of a mixture of finding those unicorns that have the experience, versus those that maybe don't, but they have a lot of potential. So we'll assign out, a writing exercise for potential writers to do. And sometimes it'll be the same one across a couple different writers. And so if I'm seeing something, in a way presented in a way that's really new to me and makes me interested in the topic again, having read, this similar article 10 times from other writers, I think I'm more inclined to work with a writer like that. And also just being able to pick up on the GoodRx voice and writing style. I like to work with writers who they may not be completely there in the beginning, but they've reviewed a lot of the content ahead of time, they've applied it, and they continue to apply feedback over time as we continue to work with them. So it just gets easier and easier to sort of edit the drafts that come in.
Yeah, that's really helpful perspective. I also wonder if there are other recommendations you give to writers who are interested in writing either for GoodRx or for other health content publishers, on like specific steps that they could take to prepare themselves or to better prepare themselves for these types of opportunities.
So I would say find workshops and programs that train healthcare professionals to write health content. I've had a few pharmacy writers come to me through programs like that, and it's worked out really, really well. They maybe didn't have a lot of experience, but they had some of the background training to better position them for a role like this. Some writers I've had, they've started creating and publishing their own health content on personal pages, so LinkedIn, blogs, stuff like that, just to sort of build up a portfolio and get feedback from people. And I would say if they're interested in applying for a freelance writer position for GoodRx, particularly with pharmacy, I would just look at the pharmacy content that we have published so you can get a sense of what we're looking for, because obviously all of these pieces have gone through the multi-step program or process that we take it through. And so you know what sort of a final product looks like, and trying to sort of mimic that, and how you approach it, how you approach your writing assignment, and things like that. And also provide writing samples with your application as well. So I can get a sense of, sort of your writing style, if it seems like a good fit, if we want to move forward, if I sort of want to, meet with you, kind of see if this is a good relationship.
Mhm. And to that point of reviewing the pharmacy content that's already on GoodRx, there's no shortage of it, right? Like you have endless amounts of content to read through and get familiar with. So you can definitely find a wealth of resources there. What about for you, Sophie?
Yeah, I mean, I would say that being familiar, I mean, one of the big things that I notice when I'm interviewing candidates is that some people know instinctively about health literacy and what it is, and some people have never heard that term before. And then there's a few people who know it but aren't really able to describe it accurately. So I think the biggest thing to wrap one's head around is what health literacy is, what it means in real life, and to educate yourself. And there's tons of free resources online. There's all sorts of, you know, not qualifications, but kind of training programs that you can do for free online on what health literacy is and how to apply it in your day-to-day life. So I would say that's, coming at uh, writing for the public with that kind of information is really crucial. Um, and then the other thing is to find a coach or a mentor or somebody who's made that transition already. Like the other thing that I see time and time again is clinicians are burned out. They're looking for alternative ways to get out of like patient facing work. And so they are so keen to jump into something that will allow them that creative outlet and give them more flexibility. And then sometimes they forget that actually writing is a professional career. And this probably doesn't apply to your audience because they're already here listening to this. But, a lot of people think I am a good communicator. I've done this for a decade with my patients. Like I can transition into writing. I did a creative writing class, maybe 10 years ago at college. But if this is something that you really want to do, I would say get a coach, get a mentor, educate yourself as much as you can for free online. There are so many resources. And then, invest in some actual training to give you the basics to be able to compete with the other writers that are out there and to really give yourself a chance of success in this new field.
Yeah.
Approach it like any other career transition.
Yeah, that it brings to mind the comment you made earlier about humility, right? There's a
Mhm.
little bit of humility that's also required for this transition because in a lot of ways you have kind of the educational and experiential foundation that you need to be a great health content writer, but you don't always have the writing piece of that or the communication piece of that. And so
Yeah.
sometimes it takes a little bit of humility to say, okay, I have half of this equation, but I need to get the other half. So how can I start the process of building those foundational skills on the writing and communication side so that I can meld them with the professional experience that I do have and kind of enter into this new path. So like you
Exactly.
alluded to, Alyssa, that's what I try to encourage the students I work with to do. And it's a lot of work. It's not easy, but it's worth it at the end. So I really
And if
appreciate
I just wanted to jump back in actually and say two, is it okay? I say two other
Yeah, go
things. So
ahead.
one is that like writing for the public, for the general public is obviously very different, like you said, to a lot of other writing that people might have done. But also writing for online content is very different as well, you know,
Mhm.
and so any experience with, you know, thinking about like reading time and the way that like stuff is laid out on a page and attention to, you know, to subheaders and headers, like any, like all of that matters and is very different to print writing. That was the first thing. And then the second thing that I wanted to say is coming back to that humility piece as well. I think a lot of people, when they're applying or getting started in writing, it's so a common mistake is to get caught up with like how much do I know about this topic and how much can I show that I know about this topic. And
Mhm.
actually writing for like certainly our audience is not about showing how much we know about the topic. It's about thinking, where is my reader at? What are they likely to be grappling with right now? And how do I meet the reader where they are and make
Yeah,
it easier for them to wrap their heads around this information? And
that's
that,
so
that
good.
shift in perspective, I think, is really important and what will allow a medical writer to succeed at this kind of work.
I think that's also what I value so much about working with content publishers who have strong editorial teams and having access to editors. And it kind of helps segue into the final question that I wanted to ask you both, which was, can you just briefly explain to folks who aren't as ingrained in this world, what do you do as an editor, and what is that relationship like between the editor and the writer?
You know, we're looking for writers with a variety of experiences, and part of that process is developing that relationship with them. And what's really fulfilling to me in working with some of these writers is really seeing them excited about being able to create content and share, you know, how they write, and to educate the public on particular topics. And so, you know, we sort of work together to come up with, you know, an outline that makes sense, that's relevant, that's applicable to Sophie's point, sort of meeting the reader where they are. A lot of times writers will pitch topics to write about from their own experience. So if they work in a particular field, you know, hey, this is coming up, there could be a really good benefit to cover this particular topic. And so it's really just an ongoing sort of relationship in developing this content, um, and building that trust. And yeah.
Yeah, and there's often just piggybacking off that, there's often quite a bit of training that happens as well,
Mhm.
right? So, you know, as Alyssa was saying, you know, it's really gratifying when that training is a worthwhile investment on our part, and we get to a
Mhm.
place where writers are spontaneously pitching great ideas, you know, submitting outlines and drafts that are bang on the money where we need them to be, and that require very minimal editing. Like that is such a, you know, a feeling of gratification for us and such a success story. So it's you know, we love building and investing in the relationships with our writers, because when it works, it's just such a great outcome for everyone.
That's wonderful. Well, thank you so much both for being here and offering your expertise and your perspective. And we will stay in touch.
Thanks so much.
Great. Thank you.